Frequent urination at night, what doctors don't know, or as they say, if you're drowning, save yourself. Patients often come to me with the fact that they often get up at night to go to the bathroom. And this is really a problem that interferes with their lives. Imagine 3, 4, or 5 times a night a person has to get up and go to the bathroom. At least it's okay if they falls asleep quickly. But if they returns to bed and then can't sleep for some time, the whole night is practically ruined. The criterion for diagnosis of frequent nighttime urination is if you get up to go to the bathroom 2 or more times at night. If this is a problem for you, you get up and go to the bathroom 2 or more times, like this video, and we will understand the significance of the problem for our patients. There are a lot of reasons. Well, it would seem the most obvious urological ones, we will talk about this, but there are also other not so obvious reasons. Different diseases, and there is also a conditional reflex. That is, when a person simply has a habit of going to the toilet and there seem to be no diseases. And, by the way, if you watch this video to the end, I will tell you about an effective technique to get rid of this, if I may say so, harmful habit of just periodically going to the toilet. It will help. And in 2-3 weeks, you can quite teach yourself to sleep all night and not run to the toilet at night. Get rid of this harmful habit. Let's sort things out in order. First of all, the so-called urological reasons. Prostatitis, prostate gland adenoma, hypermobile bladder. There are specific symptoms. Adenoma of the prostate gland. It's when you get up with difficulty, with a break in the urine stream, go to bed with the feeling that you did fully empty your bladder, lie down in bed, and seem to feel that you would still need to go. If we're talking about prostatitis, you might get up in the middle of the night with sharp pain and have only a few drops of urine. Those sudden calls to urinate will interfere with sleep. There is also a hypermobile bladder syndrome, when you get a very sudden urge to urinate, and it happens both day and night. You have to immediately jump up and run to the toilet, and sometimes there is even a probability that you will not have time to run to the toilet, and urination will occur by itself. But today I wanted to make a certain emphasis, specifically on non-urological causes. Because after all, as a rule, to whom does a person go when they complain about frequent urination? To the urologist. And the urologist finds their reasons, or at least tries to find their reasons, even without understanding that there are other diseases. I will give one clinical example. A patient comes to me, or rather he comes to our medical institution after suffering from toxic hepatitis. This is liver inflammation and toxic, directly medicinal hepatitis. That is, hepatitis developed in response to medication. So I'm telling the anamnesis. At 40, he became a big boss, and they practically started to carry him back and forth all the time. Well, practically, as well call it, a 3-seat syndrome. The car seat, the work seat, and the home seat in front of the TV. He started to gain weight, and somewhere in 3 years, he gained about 33 pounds. He started having problems, well, at least with what he went to the urologist for. Problems with frequent nighttime urination and potency. And since he was, in general, a fairly high-ranking official, any urologist who got to him wanted to treat him very actively. They searched for and found some kind of prostatitis in him. Some kind of flora had grown, which was potentially considered pathogenic. They suspected initial adenoma of the prostate gland in him. Over approximately 2 years, he was examined by 10 urologists, andrologists, various such specialists, and a nephrologist also looked into his case.
He went through about 15 courses of antibiotics, neuroseptics, due to some suspected flora that could potentially cause these problems.
It's a known situation that if you take a lot of antibiotics, it kills off the natural flora and fungi start to grow. He started to have what is called a systemic mycosis, and he was prescribed systemic antimycotics, antifungal drugs. And one of the main complications of these heavy drugs is toxic hepatitis, inflammation of the liver. And with this hepatitis, he essentially ends up in intensive care. Well, they managed to get him out. Thank God he more or less gets better. And after that, he comes to us for rehabilitation. But here's additional anamnesis. He started snoring somewhere from the age of 30. And when he gained another 33 pounds after 40, his wife noticed his frequent pauses in breathing during sleep. Moreover, he had an exacerbation of chronic tonsillitis once a year, and he had huge tonsils that almost touched each other, practically in the middle of the throat. That is, these are obvious reasons for the so-called obstructive sleep apnea syndrome, and this disease itself often causes frequent nighttime urination. You know, when a person is afraid of something, is stressed, the kidneys produce more urine, and a person who has several hundred breathing stops, naturally, he is under stress. That is, his entire body is struggling with the lack of oxygen. Another problem arises in that when a breathing stop develops, a person tries to breathe, causing a pronounced fluctuation in intrathoracic pressure. This leads to an overstretching of the heart and the production of so-called natriuretic peptide, which increases urine production. And a person begins to get up 3-4 times a night with a practically full bladder and urinate. As I mentioned, this isn't a prostate adenoma, which often causes a disrupted urine stream. This isn't prostatitis when you get only a few drops of urine. This is frequent urination 3-4 times a night. But urologists, for some reason, did not figure this out and ignored complaints about breathing stops, obesity, large tonsils. We're doing a polysomnography for him, and we see that he has about 60 breathing stops per hour. The man slept for 8 hours, out of which he didn't breathe at all for a total of 5 hours, under extreme oxygen shortage, and with an increase in urine production. But we further treated him after hepatitis. They sent him to the otolaryngologists, plus he lost weight, well, naturally, because he had hepatitis. And he undergoes surgery. His tonsils are removed. After a few days, the frequent nighttime urination disappears, and after about a month and a half, his potency is restored. It would seem, what is the connection between tonsils, frequent urination, and potency? And you see everything in the body is interconnected. And therefore, in overweight people, in people who snore and have sleep apnea, a very common cause is precisely frequent nighttime urination. And that's why I said that not all doctors are aware of this, so the patient should suspect and maybe even tell their treating doctor about this or turn to a sleep doctor. There are several symptoms that are very, so to speak, alarming in this regard. First, this is an indication of loud, interrupted snoring. Second, pauses in breathing during sleep. Third, nocturnal and morning arterial hypertension. Fourth, headaches at night and in the morning. Fifth, sweating. Usually the upper part of the body is affected. Sixth, waking up with feelings of suffocation and lack of air. Seventh, morning fatigue and severe daytime sleepiness. And eighth, like a cherry on top, decreased libido, increased urination, which I mentioned, and also progressive obesity. So these are the symptoms of obstructive sleep apnea syndrome. Or if you or your relatives have such symptoms, but with increased urination, then you need to go not to the urologist, but to the somnologist to figure out the reasons, make a diagnosis, treat sleep apnea, and effectively eliminate increased nighttime urination. Let's recall the physiology of sleep. Our sleep occurs in cycles, usually 1.5 to 2 hours. First, second, and third stage. Then rapid eye movement sleep, dreaming, and then physiological waking. Any healthy person wakes up 3-4 times a night to the point of becoming conscious. They are in a semi-dream state, but they are absolutely not bothered by this. They are not bothered by their bladder either. And even if they turned on their other side, open their eyes thinking, should I go to the toilet? They just fall asleep and forget that they needed to go to the toilet. And only in the morning, they wake up and go to the bathroom with full bladder. But if a person has insomnia, if they have developed and formed reflexes of fear of not falling asleep because they often can't do it, a bed insomnia reflex develops. This becomes a fixed reflex, a fear of not falling asleep and bed insomnia, and a person physiologically wakes up after 2 hours of sleep. They will think, oh no, I won't fall asleep now, I have insomnia, and start scanning their body thinking, oh, my bladder is not entirely empty. Should I go to the bathroom? And it's enough to think 20, 30, 40 times, should I go to the toilet or not? And decide to go. And after that, the person forms the following conditional reflex. If they wake up, they need to go to the toilet. Even if a small amount accumulates in the bladder, it's such a strong urge that you must use the toilet. And the person begins to complain about insomnia because they go to the toilet 3-4 times a night with a small amount of urine, well, because just a little bit has accumulated there, but still, they feel like they already need to go to the toilet. And by morning, they don't even feel the need to relive themselves since they got up at night. This is what is called a conditional reflex. It's not about a person having a disease, but rather a conditioned reflex. A person wakes up and feels like they need to go to the bathroom. So, I promised you that I would tell you an effective technique on how to wean a person from this conditional reflex, frequent urination, or frequent trips to the toilet at night. The most effective technique for weaning a person from the conditional reflex of going to the toilet is the technique of limiting sleep, or limiting the time spent in bed. And, by the way, it is effectively used for the treatment of conditional reflex insomnia. What's the point? Usually a person who suffers from insomnia or some sleep disorders starts to increase the time spent in bed in order to catch a decent amount of sleep. They have trouble falling asleep, they wake up in the middle of the night. Before, they could sleep for 7-8 hours straight, But now they spent 9-10 hours in bed trying to get those decent hours of sleep. But their sleep becomes more superficial with a large number of awakenings. The brain scans some internal organs more and sees that something has accumulated in the bladder and makes the person get up. But if we reduce the time spent in bed and cause a real sleep deficit, such sleep pressure will increase. Then the person, firstly, begins to fall asleep faster. Secondly, sleeps deeper. And even if they have this physiological waking, they wake up at some point with the thought, should I go to the toilet? But fall asleep because the sleep pressure is sufficiently expressed. It's enough to wake up 20-30 times in the middle of the night and not go to the toilet to fall asleep. And that's it. The person loses the relevance of this awakening. They stop triggering the reflex that they need to get up to the toilet, they fall asleep, and then they start to forget that they have these problems at all. And literally, after 2-3 weeks of sleep restriction, they usually say, that's it, doctor, it's just some kind of magic. I used to get up 3-4 times to go to the toilet for 5-10 years. But now after 3 weeks of sleep restriction, I stopped getting up to go to the toilet, and I wake up like with a bursting bladder in the morning and run to relieve myself. Yes, of course, this is achieved at the cost of reducing bedtime and sleepiness. But then we gradually increase the bedtime to the usual 8-9 hours of sleep, and the person no longer has this habit of waking up and going to the toilet. In this way, we can very effectively eliminate such a reflexive condition, nocturnal urination. Insomnia as such can lead to a person starting to get up more often at night to go to the toilet, approximately every 2 hours. And in turn, stress causes insomnia. Well, you understand what time we live in. And now we have endless stress, insomnia, and frequent nighttime urination. I wrote a book, Stress and Insomnia, How to Break the Vicious Circle, and there are 12 steps, 12 days, which will significantly improve the quality of your sleep, and in turn, possibly get rid of frequent nighttime urination. Link is in the description to this video.